Spinal cord injury, or SCI, is a devastating event that can change a person's life in an instant. Whether caused by trauma such as a car accident or fall or by non-traumatic factors like disease, SCI disrupts the communication between the brain and the rest of the body. This leads to a range of physical challenges, from paralysis to loss of sensation. But what many people don't realize is that SCI can also have profound effects on the mind. In this video, we'll explore how spinal cord injuries can lead to cognitive impairment, affecting memory, attention, and even emotional well-being. Let's begin by understanding what SCI is and why it's so impactful. Spinal cord injuries are more common than many think. Each year, tens of thousands of people worldwide experience SCI, with the highest rates among young adults and men. In the United States alone, about 17,900 new cases are reported annually. The consequences are not just physical; life expectancy drops, and quality of life is often severely affected. Thanks to advances in medical care, survival rates have improved, but the long-term challenges remain daunting. Understanding the scope of SCI helps us appreciate the importance of addressing all its complications, including those that affect the mind. When a spinal cord injury occurs, the damage unfolds in two main phases. The primary injury is the immediate result of trauma. Physical force disrupts blood vessels, axons, and neural membranes. But the story doesn't end there. A secondary phase follows, lasting weeks or even months, where inflammation, oxidative stress, and cell death expand the damage. This secondary injury is a critical target for therapies, as it can worsen neurological deficits and set the stage for further complications, including cognitive problems. Understanding these phases is key to grasping why SCI can have such widespread effects. After the initial trauma, a cascade of biological events is unleashed. Blood flow is disrupted, immune cells flood the area, and inflammatory molecules are released. This leads to swelling, further cell death, and the formation of scar tissue that blocks regeneration. Over time, these processes can spread beyond the spinal cord, affecting other organs and even the brain. The result is not just paralysis or sensory loss, but a complex web of systemic complication. Among these, cognitive impairment is one of the most troubling, as it can quietly erode a person's ability to think, remember, and function independently. Cognitive impairment is a frequent and serious complication for people with SCI. Studies show that the risk of developing cognitive problems is up to 13 times higher in SCI patients compared to healthy individuals. These issues can range from trouble with attention and memory to difficulties with problem-solving and emotional regulation. Cognitive impairment can appear soon after injury and often worsens over time, especially in those with chronic SCI. It's a hidden threat that can undermine rehabilitation, independence, and quality of life, making early recognition and intervention essential. Exact reasons why SCI leads to cognitive impairment are complex and multifactorial. Some patients have additional injuries like traumatic brain injury at the time of their SCI. Others may experience low oxygen levels, blood pressure instability, or sleep disorders, all of which can harm the brain. Chronic pain, fatigue, substance abuse, and even the medications used to manage SCI symptoms can also play a role. These factors combine to create a perfect storm, making cognitive decline a common and challenging problem for many SCI survivors. One of the key drivers of cognitive impairment after SCI is inflammation. When the spinal cord is injured, immune cells become activated and release pro-inflammatory molecules. This inflammation doesn't stay confined to the spinal cord; it can spread to the brain, where it disrupts normal function and leads to the loss of neurons. Chronic inflammation is especially damaging, as it can persist for months or years, gradually eroding cognitive abilities. Targeting inflammation is a promising area of research for protecting the brain after SCI. The brain has a remarkable ability to generate new neurons, especially in areas like the hippocampus, which is crucial for memory. However, after SCI, this process, called neurogenesis, can be severely disrupted. Inflammation, stress, and changes in blood flow all contribute to a reduction in the birth of new neurons. This not only impairs memory formation, but also makes it harder for the brain to recover from injury. Supporting neurogenesis is another potential strategy for improving cognitive outcomes in SCI patients. Blood flow to the brain is vital for cognitive health. After SCI, especially with injuries high on the spinal cord, blood pressure can become unstable. Episodes of low blood pressure or hypotension reduce the delivery of oxygen and nutrients to the brain. Over time, this can cause subtle but significant damage, particularly in areas responsible for thinking and memory. Managing blood pressure and ensuring adequate cerebral perfusion are important aspects of SCI care that can help protect cognitive function. Many people with SCI rely on medications to manage pain, muscle spasms, mood, and other symptoms. However, some of these drugs, like benzodiazepines, opioids, and anticholinergics, can interfere with brain function. They may cause drowsiness, slow reaction times, and impair memory or attention. The risk increases with the number of medications taken, a situation known as polypharmacy. Careful medication management is essential to minimize cognitive side effects and support overall brain health. Chronic pain and fatigue are frequent companions for people living with SCI. Both can sap mental energy and make it harder to concentrate, remember, or make decisions. Pain in particular can alter brain circuits involved in attention and memory, while persistent fatigue can reduce motivation and cognitive stamina. Addressing these symptoms holistically is vital for maintaining cognitive function and quality of life. Sleep disorders, especially obstructive sleep apnea, are common after SCI, particularly in those with high-level injuries. Poor sleep and low oxygen levels at night can lead to daytime sleepiness and cognitive problems. Studies show that people with SCI and sleep apnea often struggle with attention, memory, and information processing. Recognizing and treating sleep disorders is an important step in protecting the brain after SCI. CI doesn't just affect the body, it can also lead to depression, anxiety, and other psychiatric conditions. These mental health challenges can further impact cognitive function, creating a vicious cycle. Social factors such as education level and pre-existing learning difficulties also play a role in how well someone copes cognitively after SCI. A comprehensive approach that includes psychological support and social resources is essential for recovery. Early and thorough neuropsychological assessment is key to identifying cognitive impairment in SCI patients. Rehabilitation programs should address not just physical recovery, but also cognitive and emotional needs. Tailored therapies, cognitive training, and support for daily living can help patients regain independence and improve their quality of life. Ongoing research is exploring new ways to protect and restore brain function after SCI. While the challenges of SCI-induced cognitive impairment are significant, there is hope. Advances in medical care, rehabilitation, and neuroscience are opening new doors for prevention and treatment. Understanding the mechanisms behind cognitive decline allows for targeted therapies, from anti-inflammatory drugs to neurogenesis support. With continued research and comprehensive care, we can help those with SCI not only survive but thrive, both physically and mentally.